Hi everyone, Dr. Obi from Pain Free and Fit. Today we've got a great little exercise, very simple for TMJ pain. Hope you enjoy. Simple little exercise I teach my patients with chronic TMJ, jaw pain, where the jaw connects to the skull bone. Most of us have a tendency to chew more on one side than another, and as a result, we get a muscle imbalance where the masseter muscle that runs from our jawbone to our cheekbone becomes tight, or temporalis that comes down from the temporal bone into our jaw becomes tight more on one side. Typically, you're going to be able to identify this if you open your jaw and deviate it one side to the other. One side is going to be tighter to deviate to, opposite the side that those muscles are tight that you generally chew more on. If we open our mouth and deviate our jaw down into the opposite side of the tightness and hold for 2 seconds at a time and perform repetitions back and forth, will help to increase the tension, the strength of the opposite muscles, help undo some of the chronic tension on that side, and help restore, from a muscular standpoint, proper biomechanics of the jaw, often alleviating TMJ pain. You can perform this exercise either holding for 2-second repetitions, down and away, or for a more static, prolonged stretch from 15 up to 60 seconds. You can do this multiple times a day, accompanying with moving the food to the opposite side of the mouth so you have equal time chewing back and forth will help establish a more normal excursion of the jaw where it's not deviating to one side and help alleviate some of that chronic TMJ pain.